Hello, good afternoon. My name is Biljana and I'm an IVF coordinator in Unica clinic, and I'm dedicated helping numerous of English-speaking patients who turn to our clinic for their fertility treatment. I would like to thank you for joining us today for our live stream session of questions and answers. During the live stream, you will be able to ask questions using the comment field on the event on Facebook, as well as questions who have already been sent to us previously. I will start with those first. During the whole live stream, you will be able to ask questions, which I will do my best to answer them all. With, I would say, probably the most actual questions these days. We also get that from a lot of patients of ours. What is the current situation in the Czech Republic regarding the COVID virus when it comes to traveling, whether they are some limits to it or not? I will use actually the site of our Ministry of Interior, so I can share with you the list of countries which are in the so-called low-risk group, meaning they don't need any proof for being here in the Czech Republic, nor they have to have a negative PCR test. The latest update is from 13th of July, and the following countries can freely enter in the Czech Republic and stay as a tourist. So the countries that are included are Andorra, Austria, Australia, Belgium, Bulgaria, Canada, Croatia, Cyprus, Denmark, Estonia, Finland, France, Germany, Greece, Hungary, Ireland, Iceland, Italy, Japan, Liechtenstein, Latvia, Lithuania, Luxembourg, Malta, Monaco, Netherlands, New Zealand, Norway, Poland, Portugal, Romania, San Marino, Slovakia, Slovenia, Spain, South Korea, Switzerland, Thailand, and the United Kingdom. So the citizens of all these countries are able to travel to the Czech Republic as they were able to do previously before the COVID virus struck. All the other countries which are not in this list, if they are part of the European Union, they don't need a proof to have with themselves when coming here, but they do need to have a negative PCR test with them, not older than 4 days. Or all third country nationals, they have to have both proof for being here, a medical proof, which is something that our clinic can provide, of course, and a negative PCR test when entering the Czech Republic. I hope that at least covers some of your concerns about the traveling situation. I will now continue with the questions we have reserved from those of you who have registered for the live stream. One of them is, what age is considered too old for donor egg treatment? The Czech law allows women until the age of 49 to undergo fertility treatment. So if you are younger than 49, you can of course come to our clinic. We will set up a treatment for you, initial consult, and we will do our best to help in your dreams to fulfill your dreams of having a child. Can you assist a 41-year-old to conceive her second child? If this is regarding conceiving or having treatment with stimulation of your own ovaries, of course it is possible, but it is very individual. Of course, we will first need to set up initial consult with our doctor, where we will need some of your latest tests, such as control ultrasound, measurement of the hormone levels, TSH, AMH, and prolactin, latest pap test smear, sperm analysis of your partner, and based on those, our doctor will provide a treatment for you and advise what is the best option and how to proceed. This next one is, how many visits does Unica require doing donor egg treatment? Since the treatment is going simultaneously, once our patient starts with her period and starts using hormonal therapy, the donor also in the same day starts with her stimulation of the ovaries. And in such cases, basically only 2 visits are needed. One visit for the fertilization of the eggs of the donor, and the second one is for the transfer. We always recommend our patients, our couples, to come for a week. Of course, if this is not an option, you can come on 2 occasions, one on the day of the fertilization and one of the day for the transfer. But it is always good to have some more spare time here and to enjoy the beautiful sights in both Brno or Prague, depending on which clinic would you like to have the treatment. How to choose your egg donor is our next question. You always, not always, what we ask for from our patients is that they provide us with their preferences about the donor, how would they like to look, their interest, education, background. Every information that you will provide us with, we will forward it to our donor center coordinator, and she will be able to choose the best match for you. According to the Czech law, it is forbidden to see a picture of the donors. Basically, the whole program is anonymous. You will be provided only with the phenotype of the donor, meaning you will have information about her hair color, eye color, height, weight, blood type, birth year, and education. But we always ask from our patients to provide us with as many attributes they want to have the donors as possible, so we can find the best suiting match for you. The next question is, what is the waiting time for donor eggs? With the fact that our donor base counts more than 2,000 of donors, there is practically no waiting list. Once we have the initial consult with the doctor and have all your medical tests, and the doctor prepares the medical protocol for you, if there is no obstacle whatsoever in terms of your medical health, you can start with the treatment immediately, or in other words, with your next cycle. And we can find a donor in a very short time. Usually it takes 1 to 2 days to find a suitable donor, as they are constantly on contraceptive pills. Once you start with your period, the donor will start with the stimulation of her own ovaries, and her period in that way is being synchronized with yours. So the waiting time is almost not existing. I would also just like to mention again, if you have any questions, feel free to post them on our live stream. What is the success rate of egg donation treatment? That is also a question that we receive a lot. When it comes to egg donation treatment, the success rate from the first embryo transfer is 57% of success, the chances of getting pregnant. If you finish the whole cycle, and what do I mean by whole cycle? If you have several embryos which are with high quality for transfer, if the first transfer fails and then you have a second or a third, the accumulative rate of that whole cycle is 72% of success of getting pregnant. Then the next question is, what is the treatment process that egg donors undergo? They are being stimulated as same as women who are stimulating their own ovaries. Basically, first they undergo a thorough medical analysis in our clinic. They are medically tested, genetically tested. Most of them are very young women between the age of 18 and 29 with a very healthy lifestyle, non-smokers, no overweight, and they are always prepared to start with the treatment process. As mentioned previously, they are constantly on contraceptive pills, so they can synchronize easily their period with yours. I'll just check for some other questions. Right, then we have a question: when can I go home after the embryo transfer? Is a long journey safe? After the transfer itself, we always recommend for 10-15 minutes for the patient to rest in our recovery room. Basically, there are no indications or proof that long-distance traveling can affect the success of getting pregnant. We had many patients coming from abroad, flying from and back to the United States, Canada, and you can imagine these flights are long. Patients who have been flying back home the same day after the transfer, or driving home, going back by car, by train. Basically, you can go home the same day. There is no proof that bed rest in the first 3 days is necessary. We do, however, recommend our patient in the first week or two after the transfer to continue with their lifestyle as usual, but to avoid any high physical activity such as lifting heavy things or jogging or running. Basically, a more relaxed lifestyle, and again, yes, you can go home the same day after the transfer. Right, there is another question: is the treatment with the donor eggs anonymous. I believe I already mentioned that, but I will just repeat it again. You can only have the phenotype profile of the donor, meaning their hair color, eye color, height, weight, year of birth, a blood type, and education. If you don't have any questions so far, I will shortly describe you the process, how everything goes in our clinic, from the initial interest to becoming our patient through hopefully successful pregnancy and having a child 9 months later. We need our patients first to to open a profile at our Unica site, to fill in the medical questionnaire, and to answer as thorough as possible, because this will give our doctor a very good knowledge of your medical current status, and based on that the doctor will be able to advise on the treatment. We need to have some tests done previously, or if you're able to come directly to our clinic, all of these tests can be done prior to the consult, and we will have very recent results which will help the doctor during the medical consult. He will be asking questions, go through your medical history. You will also be able to ask questions, whether it's your current situation or any previous, if you had unsuccessful treatments. At the end of the consult, the doctor will provide you with the medical protocol, and he will advise how to proceed further. If the question is about IVF with stimulating your own ovaries, if everything is okay, you can start with the stimulation with your next period. If we're talking about the egg donated program, again, if everything is all right, you can start with your next period. In that time before you get your period, we can use to choose a suitable donor for you, and 2 visits will be needed for the donor process. If it's IVF stimulating your own ovaries, then we will need 2 ultrasounds to be done. The first is usually done around the 8th day of the cycle after starting the stimulation, to see how the follicles are growing. That ultrasound can be done in your country. The second one is usually done 2 or 3 days later. This one you can also have it in your country, but it is much better to have it here. We usually do recommend for our patients, if their time and possibility allows them to be here, to have that ultrasound here. And after the second ultrasound, we will know the day of the egg retrieval. That usually happens around the 15th day of your cycle, and the mature eggs are being fertilized the same days. Afterwards, the embryos are being cultivated for the next 5 days, and that's when the embryo transfer occurs. Same goes for the treatment with the donated eggs. Apart from the stimulation of the ovaries, the patient will start with hormonal therapy, meaning to make sure the endometrium is growing as it should. You will start with preparation of the endometrium, taking folic acid and estrofen. around the 10th day of your cycle, you need to have a control ultrasound so we can check how the endometrium is growing. In the same time, simultaneously, the donor is having her control ultrasound. And after her second control ultrasound, we're able to tell when the fertilization will take place. That is the day when we need for you to be at the clinic. If the female patient is not able to be at that time, then that's okay, but the male patient will need to be at the clinic for giving a fresh sample of sperm for fertilization, unless you're able to come previously to the clinic and have a sperm test done at our clinic, and at the same time have that sperm frozen if it's with a good quality, which we can use then for the fertilization of the donor's eggs. After the fertilization happens, again, as in the previous treatment with stimulating your own ovaries, the embryo is being cultivated for 5 days and the embryo transfer occurs 5 days later. On the day of the egg retrieval of the donor and fertilization, apart from the estrogen, you will start taking the other hormone, progesterone or utrogestan, continuing along, of course, with the estrogen. And after the transfer, you will continue with this hormonal therapy in the next 2 weeks, where you will need to make a pregnancy test. After 2 weeks, it is usually advised to have a blood test to measure the beta HCG level. If they confirm a positive pregnancy test, you will need to repeat the same test after 2 days, so we can see that the measured level has doubled. And if again it's a positive, then continuing with that therapy, after 4 weeks of that, you will need to have a control ultrasound to check for a heartbeat. If everything goes well, you will continue with the therapy up to until the 12th week of pregnancy. By that time, the body is able to produce their hormones by itself. That's why it's safely, we can safely say that it's okay to stop with the hormonal therapy around the 12th week of your pregnancy, because by that time the body is capable of producing those hormones by itself. And hopefully we will get, after 8 months, a picture from your child. I will just check if there is something else. And the questions. If you have any other questions or other questions might occur after watching this live session, you are more than welcome to always contact us on our on our Facebook page or directly on our site. There are also many videos which you can look at, discussions with our specialist doctors on our YouTube channel. Just type in Unica Clinic and you will be able to find it. They're also in different languages. We have many yoga sessions also filmed in different languages, and we will surely do our best to answer those questions and help you with any problems you might be facing with your fertility. Again, I would like to thank you for your time. Thank you for being today. I hoped I provided enough information to those questions that we already received on our site. and I would like to wish you a nice rest of the day. Thank you.